good afternoon. I'm here today with Minister Copping, as well as the Chief Medical Officer of Health, Dr. Hinshaw, and the President of Alberta Health Services, Dr. Yiu, to provide an update on the Omicron variant of concern that has recently been detected here in Canada. Last week, a new strain of COVID-19, the B11529, or the Omicron variant, was detected in southern Africa. While it is still early, and global public health officials are working quickly to learn more, initial evidence suggests that this variant has an increased number of mutations and increased transmissibility. As a result of this preliminary information, the World Health Organization has declared it a variant of concern. As is the case with COVID-19, the situation with the Omicron variant is evolving quickly. Over the weekend, cases of this variant have been detected in more than 14 countries, including Canada. Yesterday, the Ontario government announced that 2 cases had been detected in Ottawa. Both of these individuals had recently traveled back from Nigeria and are now in isolation. I understand more cases have been reported today. Here in Alberta, 156 travelers have been identified who had returned in the past 2 weeks from one of the countries identified in Canada's enhanced border measures. These travelers were contacted over the weekend with information on current protocols, including testing and quarantine requirements. These travelers and their households have also been offered household rapid testing kits in addition to PCR tests. To be clear, no one has tested positive here, but we're working with these individuals to reduce any chance of spread. As a precaution, the following measures will be implemented for all COVID-19 cases identified in returning international travelers here in Alberta. Full case investigations and contact notification, PCR testing for all close contacts, and rapid testing for households in specific settings like schools and childcare settings. For all confirmed Omicron cases in people who did not travel, all close contacts will be investigated and asked about symptoms 14 days following exposure, and anyone with symptoms will be treated as a probable case. We believe that stopping this new variant at our borders is an essential first line of defense to prevent spread, so I am pleased that the federal government responded to Alberta's call to ban travel from the countries of concern and is now implementing enhanced measures for those who have recently been in the Southern Africa region. However, as the variant spreads to other countries worldwide, more must be done, and done quickly, to prevent an influx of variant cases from coming here. Our government will continue to urge Ottawa to do more now to protect Canadians and Albertans from Omicron. While we continue to encourage Ottawa to take strong action, we've been taking action here in Alberta by screening for the new variant through our provincial genetic sequencing program. This robust program can detect all known strains of the virus, including the Omicron variant. To date, no Omicron cases, as I've said, have been identified in Alberta. And I can assure you that we'll continue to screen all COVID-positive samples for variants. In a few moments, Dr. Hinshaw will provide details on a response plan to help detect, trace, and isolate any potential Omicron cases in the province. Now, I know that many Albertans are probably hearing the news of this new variant and wondering what they can do to protect themselves and their loved ones, especially since we don't have any evidence of it being in the province just yet. Well, the answer is simple. You can help us prepare for the eventual arrival of Omicron by getting vaccinated and closely following our provincial public health measures. In fact, the most important thing that any Albertan can do right now would be to protect themselves and those around them by our healthcare system as well, and our hospitals, by getting vaccinated if you're not yet. While we're still learning about Omicron, the vaccines available in Canada have proven to be highly effective against all other variants of COVID-19 that have emerged. If you're one of the 600,000 eligible Albertans for a booster dose, and by the way, that's everybody over the age of 70, plus all Indigenous people in Alberta over the age of 18, you can book an appointment now to provide yourself with an extra layer of protection. And on that point, we hope to have more news on a significant expansion of that eligible booster shot population soon. If you have only received one of a 2-dose vaccine series, book your second shot for 8 weeks after your first. If you haven't yet received a vaccine at all, please do so now. If you're a parent considering vaccinations for your children aged 5 to 11, who are newly eligible for the pediatric Pfizer vaccine, please seek out factual information to help inform your decision today. Last Friday, we began administering pediatric first doses to kids between 5 and 11, and the uptake has been strong. To date, we've administered more than 18,400 doses in that age range, and there are more than 57,000 appointments booked for the next 4 weeks. I want to thank all of those young Albertans and their parents or guardians for taking advantage of the opportunity to protect themselves and those around them. It's wonderful to see. If you're the parent or guardian of a child in this age range and have questions about the vaccine, I'd encourage you to attend the telephone town hall that Dr. Hinshaw is hosting tomorrow night at 6:30 p.m. She'll be joined there by physician colleagues who have significant pediatric experience and expertise. Participants will have the opportunity to ask the doctors questions about the COVID vaccine for kids. All you need to do is pre-register by noon tomorrow at alberta.ca/townhall, and you'll be sent the dial-in number to join the discussion. Achieving the highest vaccination rates possible remains key to reducing the risk of COVID-19 transmission and preventing a significant surge in cases. Here's some good news. 89.2% of eligible Albertans over the age of 12 are at least partially vaccinated now, and nearly 84% are fully vaccinated. Albertans have worked so hard to get our case numbers down and to free up capacity in our hospitals by following the public health restrictions and guidelines, by participating in the restrictions exemption program, and by getting the jab. These actions together got us through the fourth wave, and I'm confident that they can help us tackle the Omicron variant or any other developments in the days and weeks to come. Thank you for staying the course and continuing to do your part. It'll take time before we know exactly how Omicron will behave, but we are much better prepared for Omicron than any other variant before it. So while this news is, I know, frustrating for us all, Omicron should not cause people to despair. We have demonstrated great resilience, and with widespread vaccine coverage, plus new treatments emerging from trials and better medical information on how to treat COVID-19, we have reason to believe that we can overcome the challenges ahead. I know nobody wants to hear news like this, especially as our friends in the Jewish community have just begun to celebrate Hanukkah and Christmas is just around the corner. But I ask that Albertans remain patient and vigilant as we learn more about this emerging variant. Thank you, and I'll now invite Minister Copping to add some additional remarks. We'll then hear from Drs. Hinshaw and Yiu.
Thank you, Premier, and good afternoon, everyone. Once again, I want to join the Premier in reassuring Albertans that we're monitoring the situation closely and will continue to take any steps that we need to protect Albertans through this. Now, fortunately, as noted by the Premier, the vaccines we have available have been effective against other COVID variants. Getting vaccinated continues to be the best way to protect yourself and those around you from COVID-19. I would like to thank the more than 3.1 Albertans who are now fully vaccinated and about 190,000 Albertans who have gotten their first dose. That being said, I know that there are those who are still hesitant. If you have concerns about the vaccine, please speak to a trusted healthcare professional to get the information you need so you can make an informed decision. Vaccine hesitancy is an issue that we continue to work to address. Like many employers, Alberta Health Services has put in place a mandatory immunization policy for their staff. I'm pleased to see that over 96% of AHS employees are now fully immunized and compliant with this policy, along with over 99.6% of physicians. I fully support AHS's decision to implement this policy, and my preference is to see all vaccine-eligible Albertans get immunized, especially those on the front lines of providing health care. However, there are some who have not done so, and this is a concern, especially in smaller communities where there's a potential loss of staff and an impact on patient care. The #1 priority must always be patient care and ensuring all Albertans, regardless of where they live, have access to the health services that they need. I do not want to see services in any community reduced because staff are unable to work. As such, I have directed AHS, as part of their staff immunization policy, to introduce rapid testing at locations where there is a significant risk of service disruption due to unvaccinated employees. I am hopeful that we'll see all our healthcare workers make the choice to get vaccinated against COVID-19. But at this time, an adjustment to the policy is required in the interest of protecting patient care. Now, I know our health workers have been working tirelessly since the start of the pandemic to take care of Albertans and their families. I extend my sincere gratitude to all healthcare workers for all the work they have done and continue to do throughout this pandemic. For all those who are struggling with this decision, I want to stress that the vaccines approved for use in Canada are safe and effective. And I strongly encourage all Albertans who are eligible to get their vaccine now so we can prepare for the eventual arrival of the Omicron variant and continue to work our way through this pandemic together. Finally, I'd like to provide an update on the technical issues with the federal QR code vaccine record. Last Wednesday, we launched an updated QR vaccination record that meets the federal government requirements for air and rail service. The goal of the update was to provide one record that Albertans can use for the restrictions exemption program here at home and for domestic and international travel. Unfortunately, within hours of launching, a technical issue on the alberta.ca/COVID records website resulted in a possible privacy breach. The website was shut down immediately following initial reports of this potential issue, and an investigation is ongoing to understand the technical cause of the problem and the number of Albertans affected. The technical problem has since been resolved, and the updated QR code vaccine record is now available for print or download at alberta.ca/COVID records. Protecting Albertans' personal information is essential, and on behalf of the Government of Alberta, I apologize to this potential breach, and I want to thank all Albertans for their patience while we worked to resolve this issue. I also want to assure all Albertans that the QR code record is not connected to any other health or personal information, and additional checks are now in place to prevent this from happening again. Now, the investigation is still ongoing, and we will update everyone once it is completed. As a reminder, as of last week, paid entry markets and trade shows are now eligible to participate in the restriction exemption program. We also introduced modified program for ski hills. Please visit alberta.ca for a full list of the types of businesses, organizations, and venues that are eligible for the REP. Now that the updated QR record is available, I would like to remind Albertans that there is no need to save or print the updated version if you do not intend to travel. Both the previous version of the Alberta QR code vaccine record and the updated one for travel are accepted by Alberta businesses taking part in the REP and can be scanned by our Verifier app. Please continue to download your QR code, as any Albertan looking to attend business that is taking part in the REP will need to have it or have privately paid for a negative test for the last 72 hours or provide a medical exemption. If you have been providing negative tests and are now ready to make the choice to be vaccinated, you can do so today. Appointments for all vaccine-eligible Albertans can be booked online or by calling 811. Walk-in clinics are also available for those aged 12 and over. Visit alberta.ca/vaccine for more information. Now, thanks again, and I will now turn it over to Dr. Yiu to speak more on the AHS immunization policy.
Good afternoon. I want to provide you with an update to our immunization of workers COVID-19 policy. But first, I want to express my heartfelt thanks to all of our staff, physicians, and volunteers for getting immunized. As the Minister said, more than 96% of our full-time and part-time staff and more than 99.5% of our physicians are now fully vaccinated against COVID-19. Those are truly impressive numbers, and I'm very appreciative of the vast majority of our staff, physicians, and volunteers who have done the right thing themselves, their loved ones, and most importantly, to helping protect their patients. I acknowledge that for some of you, the decision to get immunized was a difficult one, but it was the right one, so again, thank you. It is disappointing that about 3,000 of our staff have either not submitted proof of vaccination or have decided to remain unvaccinated. We have done all that we can do to encourage them. We've reached out to provide evidence-based reasons to get the vaccine and have worked hard to answer any questions or concerns that have been raised. And we have stressed just how valuable the vaccine is in protecting those in our care. Unfortunately, there are a small number of areas within our healthcare system where lack of vaccination may impact patient care, and this raises concerns for us all. That is why today, at the direction of the provincial government, we are informing our staff and physicians that AHS will temporarily introduce frequent targeted COVID-19 testing as part of the organization's mandatory immunization policy. The temporary testing option will be introduced at a small number of affected clinical work locations starting on December the 13th, 2021. The policy deadline for staff to be fully immunized will also be adjusted to December 13th to accommodate the introduction of this testing option. I want to be clear that the testing option is temporary and will be limited in scope. Only clinical work locations deemed to be at significant risk of service disruptions due to staffing shortages resulting from unvaccinated staff will be part of the testing program. The temporary testing option will only be available for a very small number of staff at a small number of specific healthcare locations. For example, frequent testing will be an option at a site where a sole medical device reprocessing technician is decided not to be immunized and no other staffing options are available at this time. Not having a testing option available in such a scenario could result in closing of an operating room and a reduction in surgeries. This temporary testing option, if taken up by the employee, will ensure that patient care is not impacted at that work location. As of Friday, we anticipate about 260 employees will be eligible for this temporary testing option across approximately 16 work locations provincially. This represents 0.2% of our staff at about 3% of our AHS work locations. We anticipate that this number of eligible staff for testing will decrease, just as it has done so over the past few weeks, as we continue to implement additional mitigation strategies to ensure that any service disruptions are limited. The testing directive will be reviewed end of March 2022. Eligible employees or medical staff at affected sites who are not fully immunized and who choose the testing option will be required to provide proof of a negative Health Canada approved COVID-19 test that has been completed no more than 48 hours before each of their working shifts at their own cost. A positive rapid test will require the individual to be off work until results of a follow-up PCR test are available. If an eligible unvaccinated employee at the affected sites opts not to provide regular proof of a negative COVID-19 test, they will be placed on an unpaid leave of absence. Medical staff at affected sites who opt out will be subject to review by the medical staff bylaws. Employees at all other sites who have not been granted an accommodation and remain unimmunized by December 13th, 2021, will also be placed on an unpaid leave of absence. AHS stands by its immunization policy, which was implemented to protect patients and healthcare workers. Patient care has always been the focus of our mandatory immunization policy. AHS must do all that it can do to ensure that patients, particularly those that are most vulnerable and immunocompromised, are protected while in our care. Healthcare workers have an ethical and responsible professional responsibility to protect others. Immunization is a tool to assist in meeting the standard. We continue to recommend COVID-19 immunization to all of our employees and physicians as part of our overall approach to protect patients and one another. I acknowledge that the introduction of a temporary testing option may frustrate physicians and staff who have made the decision to get immunized, and those feelings are valid. That's why I want to end by thanking everyone again who did the right thing to get vaccinated for COVID-19. Because of you, our hospitals are safer for our patients, and our frontline healthcare workers are better protected from catching the virus while caring for Albertans. Thank you, and I'll pass the podium to Dr. Hinshaw.
Thank you, Dr. Yiu, and good afternoon, everyone. Over the last 24 hours, we identified 228 new cases of COVID-19 and completed about 5,000 tests. On Saturday, we identified 253 new cases from about 6,600 tests. And on Friday, we identified 325 new cases and completed about 7,500 tests. There are currently active alerts or outbreaks in 154 schools. 7 of these schools have had 10 or more cases infectious in the school within the last 14 days. There are currently 432 people being treated for COVID-19 in hospital, including 77 in the ICU. Sadly, I must announce that 7 new deaths have been reported to Alberta Health since November 25th, ranging in age from 33 to 92. I extend my sympathies to the family and friends of these individuals and to anyone who has lost someone they loved, no matter the cause. As the Premier said, we are closely monitoring new developments around the Omicron variant. My team and I are working with our public health colleagues across the country and around the world to understand more about this emerging variant and to keep an eye on its spread. At this time, there have been no cases of this variant detected in Alberta. However, as we have seen with other variants, it is very likely that Omicron will eventually reach our province. Our goal now is to delay the spread of Omicron until we learn more about it. I also want to remind all of us that while there are many unanswered questions about how the Omicron variant will behave, we know a lot more about COVID now than we did before. This knowledge means we are not going back to step 0. We still have a lot of tools at our disposal to address this new variant. Today, I would like to explain several steps that we are taking in response. First, I want to assure Albertans that our provincial lab is currently screening all COVID-19 positive samples for previously known variants. In the past week, for example, 99.8% of all Alberta cases have been the Delta variant. All samples that screen negative for Delta are sent for full genetic sequencing. This will help us to identify any cases of Omicron. All non-Delta variant cases in recently returned travels from any country will be prioritized for genetic sequencing. In addition to this sequencing, we are also implementing additional processes for all COVID cases identified in all returning international travelers. This includes an expanded case investigation, contact tracing and notification, PCR testing recommendations for close contacts, and an addition of rapid testing options for household contacts. Unimmunized and partially immunized close contacts of a confirmed case in any returning international traveler will be asked to quarantine at home for 14 days after their last contact with the case. If cases in a recently returned international traveler are identified in schools or childcare facilities, all class or cohort contacts will be notified and will be advised to get tested through AHS. I would like to remind Albertans that returning travelers should be treated with compassion, and the majority of travel-related cases right now are not Omicron. However, we are taking these interim measures in order to prevent potential spread as early as possible, giving ourselves time to learn more about the variant. If a case of Omicron is identified in someone with no travel history, this would likely be about 2 weeks after the initial positive result. In this instance, a retrospective case investigation will be done. Close contacts will be advised to be tested for COVID-19 regardless of when they were exposed to the infected individual. if any of those close contacts had developed symptoms within 14 days of being in contact with this confirmed case, they would be considered a probable case, and AHS would perform contact tracing for their close contacts as well. Finally, I also want to remind all of us that isolation for COVID symptoms and confirmed COVID cases of any type continues to be mandatory. Anyone who tests positive for COVID, no matter the strain, is legally required to isolate for 10 days from the beginning of their illness, away from both members within their household and outside their household. I would like to remind Albertans that the steps related to Omicron are being taken out of an abundance of caution. In the coming weeks, if we learn that Omicron does not pose new risks, these measures will be reassessed. The emergence of this new variant is yet another reminder of how important vaccination is. Having a complete vaccine series provides the highest level of protection we have against severe outcomes, and this has been true with all new variants of concern in the past. With COVID vaccine now available for those aged 5 to 11, I know that a lot of parents are still working through the decisions around vaccines for their children. As the Premier mentioned, I'm hosting a town hall tomorrow night with other physicians to answer questions about COVID-19 vaccine and children. To attend, register online at alberta.ca/townhall by noon tomorrow. We will continue to keep the public updated as we learn more about the Omicron variant, and will make any adjustments necessary to protect the health and safety of Albertans. Thank you, and we're happy to take questions.
Thank you, Dr. Hinshaw. That concludes the formal part of today's announcement. We'll now move over to a brief media Q&A. Operator, can you please put through our first call?
Thank you. The first question is from Jason Herring, Calgary Herald.
Hi there. My question is for Dr. Hinchey, I think. The Public Health Agency of Canada and Dr. Theresa Tam recently updated guidelines earlier this month on airborne transmission of COVID-19. I'm wondering how we in Alberta are altering our guidelines or our approach to reflect this federal change.
In November of 2020, so about a year ago, we did put up detailed information with respect to aerosol type transmission that indicated the risk factors that made aerosol transmission a higher likelihood. We built that into our guidance from that point forward. We have looked at the new masking guidance that was released by the Public Health Agency and have worked on updated masking guidance that is specific to Alberta. I'm not sure if that's been posted yet. We can double check and find out, but ultimately the aerosol type transmission information briefing that we posted a year ago is still very important, and I would encourage Albertans to read through that to understand the risk factors that make it more likely that there is long-range transmission that takes place, and that has been built into our guidance again over the past year.
And Jason, do you have a follow-up at all today?
Yeah, I think I have a follow-up on another topic for Dr. Yiu on the Alberta Health Services vaccine mandate. Are you worried that this sends the wrong message to Albertans generally and also healthcare workers who did get the vaccine, that we're having a second extension to this vaccine mandate deadline after staff members are already given an extra month to get their shot?
Yeah, thanks very much for the question. We stand steadfast on our vaccine policy. Our focus is always to get as many staff vaccinated, and as you know, we've had more than 96% and more than 99.5% of our physicians vaccinated. So it's very important to make sure that that's always been our focus. When we started off with the policy, one of the things that was a critical part of the policy was to ensure that we were able to actually understand what exactly were the vaccination numbers. And so part of it was the reporting of the vaccination numbers. And I think to say that, you know, we are quite concerned about some of the smaller facilities and work programs where we want to deliver care, but we are worried that the unvaccinated numbers might actually exacerbate some of that care delivery. So if a testing option can help prevent that, and please note that this is temporary until we can get full mitigations in place, If we can get a testing option that can help mitigate that, then it is very important for us to obviously deliver the service and make sure it's not impacted.
Thanks, Dr. Yiu. Operator, can you please connect our next call?
Julia Wong, CBC.
Hi, this question is for the Premier. This morning, Ontario called for point-of-arrival COVID-19 testing for everyone entering Canada. Do you echo those calls?
Thank you. Well, we certainly will take the advice of the medical practitioners in that respect. We did call for the federal government to ban travel from the countries of concern on Saturday, and we're pleased that they followed through with that, in addition to the additional measures for enhanced border screening, for quarantine requirements for people returning from those countries, and I've also delineated a number of measures that we're taking here in Alberta in that respect. In terms of every traveler from every jurisdiction, of course, they already have to be fully vaccinated. They have to have a negative PCR test before they board an aircraft, and they go through symptom screenings, temperature checks. So I would say there's already quite rigorous protocols in place. I'm not sure that adding a second test to the vaccine mandate and the pre-departure PCR testing would have any meaningful impact. But if that's the advice from PHAC or our own people, I would certainly echo that. I haven't heard that to date.
And Julie, do you have a follow-up today?
Yes, I do. Thank you. Also for the Premier. Tomorrow, COVID-19 tests for fully vaccinated Canadians taking short trips abroad will be mixed. Do you think this plan should still go ahead in light of the Omicron variant?
Again, the reality is that for those 72-hour trips, people were having to do the return testing before they even left Canada. So it really was of no utility. And I think we have to acknowledge that there are many border communities where people go back and forth across the border as a part of their normal lives. Think of Point Roberts in the state of Washington, where people have to travel from Washington through BC to get to their schools every day. So there's a lot of communities like that across the Canada-US border, and I think that small modification makes a lot of sense for those border communities, because otherwise Canadians who are going down for like one-day trips were having to get their negative test for return in Canada, and that just made no sense. Look, I think we need to address where the issues of concern are in terms of the countries where we know there has been significant numbers of Omicron cases reported. That constitutes the several countries in the southern region of the African continent. Together with but let's face it, there are very rigorous travel protocols, including the full vaccination requirement, that significantly reduce risk.
Thanks, Premier. Operator, please connect our next call.
Win Oler, Global News.
Hi, my question is for Dr. Yiu. You made it very clear that it was at the direction of the provincial government. Does that mean that this was not something that you wanted to put in place, this change in testing?
Yeah, thank you for the question. I think that we were prepared to stay our course. After saying that, we were also concerned about some of our smaller work locations in the smaller communities in rural Alberta where service may be impacted. And as I said before, if the testing option can help mitigate and give us a bit more time so that we can bring in further mitigation so that there is no service disruption, then that's the option that was brought forward. So as I mentioned, we were prepared to continue on our current route, but obviously the rapid testing provides us with an option to make sure that service is not disrupted. Okay.
Thanks, Dr. Yiu. And just to comment further, and again, I commend AHS and all the AHS employees who have gotten vaccinated. This is an issue that was under ongoing conversation between AHS and the government in terms of what the potential impact is on service and the ability to provide service to Albertans, particularly those locations where there's already a shortage of staff, and then people who hadn't got vaccinated at this time, can we actually be able to provide that? So we, AHS came forward with a list of locations where there's high risk associated with impact on services, and we made the decision to be able to focus on, we do need, in an ideal world, 100% people will vaccinate and be able to provide all the service. This isn't an ideal world at this point in time, so on a temporary basis, we provide a testing option so we can continue to provide service while we're working towards our goal of supporting the vaccination policy and getting all healthcare, all people at AHS who are providing healthcare services to be vaccinated. Because really, at the end of the day, this is all about protecting the patient. Number of patients are, immunocompromised. Even if they are vaccinated, they're at higher risk. So the ideal is to have everyone vaccinated, but we also need to provide the service. So we came together, did the analysis, and thanks AHS for the analysis, and put forward this directive to be able to provide the best care we can for Albertans across the entire province.
Thank you, Minister. Quinn, do you have a follow-up today?
I do. This question is for the Premier. Premier, you said we were better prepared this time around. How do we prevent the collapse of the healthcare system that we saw in the fourth wave if we see a fifth, especially with this new variant?
Well, first of all, I would not, I'll take my mask off here. I wouldn't accept that characterization of a collapse of the healthcare system. The system was certainly under severe stress, and we acknowledge and thank our fantastic frontline health professionals for having risen to the challenge. But we never brought in triage protocols to deny people care. We never exported patients from Alberta. To the contrary, we have consistently had out-of-province Canadians in our hospitals that we've been offering care to in ICU, including for COVID. Over the past 20 months. So it's not accurate to say that the system collapsed, but obviously the primary goal throughout our entire 20 months in combating COVID has been to prevent that kind of catastrophic outcome in our healthcare system. And that is why we are taking the measures we've announced today to ensure additional screening, tracing, quarantine and follow-up with respect to international travelers, particularly from countries of concern, as we monitor this. But I don't think it's helpful at this point to assume the worst about Omicron. There's a lot we do not yet know about this. We need to be prudent, careful, and cautious. That's why today we are reinforcing our call on Albertans to, I suspect over the past 10 weeks or so, many people may have become less mindful of the public health measures and restrictions. And perhaps there are still some unvaccinated folks who think that the worst is behind us and it doesn't matter anymore. So the message we're sending them today is it does matter, that Omicron may pose very significant risks. So please do your best to follow those measures and restrictions. Please get vaccinated if you're not. Get the booster dose if you're eligible. In the meantime, we will follow, of course, very closely the emerging scientific data on Omicron. What we see, I think, so far it's very early, is that there has not been significant evidence of severe outcomes in countries where there have been many cases reported. That may be because those are disproportionately younger people with confirmed infections. On the other hand, we know that those African countries that have been so far hit by Omicron have much lower levels of vaccination than Canada or Alberta. And in fact, many of them are well below 50% vaccine coverage. We are now approaching 90% for adult Albertans. So I say that we are better prepared in part because of that, in part because we have now very high levels of vaccination. We'd like to keep going further. But the medical science has learned a lot about how best to address this disease over the past 20 months. There are better treatments. There are new therapeutic treatments and drugs coming out of clinical trials and moving to regulators, hopefully for approval, which will further improve the ability of the healthcare system to cope. So my point is, 20 months into this, we wish it was all behind us. It's not. But with the advances we've seen with vaccines, therapeutics, treatment, and I think public awareness, I do believe we're in a better position.
Thanks, Premier. Operator, can you please connect our next call?
Camilla Di Giuseppe, CTV.
Hi there. Good afternoon. Thanks for taking my call. This question is directed at the Premier. Premier, will the current restrictions on indoor gatherings be extended through Christmas and New Year's? And what is your guidance to Albertans as they make plans for the holidays?
We'll be speaking to that at some point in the near future. Today, we're here to talk about the challenge of the Omicron variant. We are looking at how to address the forthcoming holidays. As you know, one key trigger that I've articulated is getting our total ICU pressure below our baseline of about 173 beds. We've made good progress on that thanks to the diligence of Albertans. We are today at, I believe, just over 200 total ICU patients and about 70 with COVID. So we're now at 115% of ICU capacity. And the numbers have been trending in a positive direction. So if that continues, if we don't see alarming evidence about severe outcomes from Omicron, we will consider some kind of a potential modest relaxation of gatherings, primarily because we are concerned about compliance. And, right now we've been asking people since the 4th of September not to gather indoors with more than 2 households, maximum 10 people. We thank folks who have carefully followed those rules. We want to make sure that the rules that are in place are rules that the majority of people will follow. So we're balancing all of these things out right now. We haven't made any decisions, but as long as ICU pressure continues to abate, we may be in a position to consider something as we move closer to the holidays.
And Camilla, do you have a follow-up today?
Sure do. Premier, Manitoba is currently making COVID booster shots available to anyone who wants one. BC is looking to expand theirs to the general public on January 1st. I know you touched on this briefly earlier, that Alberta will be looking at doing something at some point with expanding the booster program here,
right.
But do we have any indication maybe when that might happen or who that would include? Just
Sure.
to give Albertans a heads up, an idea of what will happen.
Yeah, very good question. So just first of all, as you know, we did expand it. First, we started with seniors in congregate care settings and health care workers who had a very short interval between their first and second doses. We then expanded it to all Albertans 70 years of age and older, plus all Indigenous people in Alberta 18 years of age and older. And the basic advice that we have received from both the National and Alberta Advisory Committees on Immunization is not to administer booster shots to people until there has been a 6-month period elapsing since their second dose. So we are eagerly waiting for advice from the Chief Medical Officer, from Dr. Hinshaw, her team, based on the advisory committees on immunization, hopefully to expand that to a much wider range of adults. But again, one of the reasons we haven't rushed on that is because the vast majority of the adult population didn't receive their second dose until about 4 and 5 months ago. So most adults will just be coming up on that 6-month period as we move into December. So that's where it becomes relevant. We're not going to start offering booster shots to people until they pass that 6 months, and with the exception of a few unique cases.
Thanks, Premier. Operator, can you please connect our last call of the day?
Thank you. Robert Tuttle, Bloomberg News.
Yes, hi. This is for the Premier. There's a real threat of either a strike or a lockout at the Cargill High River meat plant as early as December 6th. Does the province intend in any way to intervene to prevent that from happening?
Well, we're monitoring the situation very closely. That's a unionized workplace, and the union has certain rights under Alberta labor legislation, which we respect. At the same time, we very much hope that the union and employer will come to an agreement, because the closure of that facility would have a devastating impact on the broader Alberta beef industry, which has already had a super tough year. with the dry weather and huge inflation in feed costs. As you know, many Alberta ranchers, I think overall, they had to liquidate about 20% of the provincial herd, which was very substantial because of the feed cost inflation. And that means more cattle are in the system waiting to be processed at feedlots. And we're also seeing, as you know, very significant food inflation. So the ability of families to afford groceries could be affected as well if that strike goes ahead. So we hope that the parties will come to a resolution. And I know that our Minister of Labour would always, the Department of Labour, Minister of Labour would be willing to provide any support if called upon by the two parties in terms of mediation or what have you. So we hope it doesn't happen, but at the end of the day, there is a legal process that governs strike action in Alberta.
Thanks, Premier. Robert, do you have a follow-up with that today?
No, that's it. Thank you.
Thank you. Okay, so we'll just finish off the day with our one question in the room. We have Audrey Naveau from Radio Canada. Go ahead, Audrey.
Merci.
Vous étiez très patiente.
Merci. Une question pour vous en français sur quelque chose dont vous avez parlé. À quel point êtes-vous inquiet par ce variant Omicron, particulièrement la perspective que ça puisse générer une 5e vague en Alberta éventuellement?
Évidemment, ça nous inquiète parce que ça paraît que la variante est beaucoup plus... excusez-moi, I'll try this again in French. Ça nous inquiète parce que la variante ça augmente beaucoup plus vite qu'auparavant. Mais nous n'avons pas la preuve, les données médicales que le nouveau variant crée plus de résultats sévères dans le système de santé. Alors, c'est trop tôt. Nous surveillons la situation de près. Nous apprécions les mesures prises par le gouvernement fédéral pour barrer l'entrée au Canada des étrangers provenant de pays en Afrique du Sud. Et nous prenons nos propres mesures ici en Alberta pour mieux surveiller les gens qui sont arrivés de cette région-là. Alors, nous continuons de surveiller la situation et nous prendrons les mesures nécessaires pour protéger les Albertains de ce nouveau variant de COVID-19.
Merci. I'll ask my second question in English because I'd also like to hear Dr. Hinshaw, but if you can answer in French too.
Sure.
Are you anticipating a 5th wave with the fact that people will be gathering indoors more because of the cold weather and especially the upcoming holidays?
Well, one thing we know about not just COVID, but other viral respiratory diseases of this nature is that they move in waves. So yes, I think we can expect future waves. The question is, will those future waves pose a risk to the capacity of our healthcare system? That's always been the key question. Now that we're approaching 90% vaccine coverage for adults, and we have better, I think, new medical treatments that are emerging, hopefully to approval in the new year, I think we'll be in a much better position than we have been in the past to address new variants and future waves. En français, évidemment, nous inquiétons des vagues futures, mais nous savons avec le COVID-19 et toutes les autres maladies comme ça, qu'il y a les vagues. Ça, c'est le fait épidémiologique. Alors, mais avec un taux de vaccination dans la population adulte albertaine de presque 90%, et avec les nouveaux traitements qui sont proches à l'approbation, je crois que nous sommes dans une beaucoup mieux position à s'adresser aux menaces de COVID-19, y compris une 5e vague potentielle. And I'll invite Dr. Hinshaw to complement that.
Thank you, Premier. And I would say, just in addition to that, we know that the sequential variants of COVID-19 have become more and more infectious. The Delta variant is extremely infectious, and for those Albertans who are not fully vaccinated, I would say it's a question of time. I believe everyone will at some point be exposed to COVID-19, and so would really advise those who don't have the protection that vaccine offers to take advantage of this time now where cases are relatively low, lower than they have been in a while, to get that protection for those who have been infected before and who are wondering whether or not they need vaccine. We know from studies that someone who's been infected and then has a dose of vaccine actually gets broader protection, and especially looking at protection against new and emerging variants, having infection and then getting vaccine, recommended to get a full dose, a full series of vaccine that does provide increased protection, more than just having had infection alone. And again, with the emergence of Omicron, while there's lots that we don't know about it, it does seem in at least some of the countries where it's been reported that it could be out competing the Delta variant. And if that's the case, again, that infectiousness is going to be something that we need to watch. Again, we need to make sure we do our best to prevent severe outcomes. And the number one way we can all do that is by expanding the coverage that we have in our population of vaccine.
Thanks, Dr. Hinshaw, and thanks for you folks for joining us today. This concludes our media availability. Thank you.